All right, everyone. Just wanted to welcome everybody to tonight's webinar, Transforming Patient-Centric Care with a Light Adjustable Lens. Excited to get going tonight with our special guest, Dr. Jeff Whitman, the President and Chief Surgeon of LASIK and Cataract Vision Correction Specialist at Key Whitman, and Roy Freeman, the Senior Vice President of Marketing and Professional Relations at RxSight. So they're going to be kicking off the discussion here tonight, and then we'll be picked up by our CMO, Marcus Hackler, and myself, the Vice President of Sales here at Clarity Technologies. So with that brief introduction, I'd like to go ahead and open it up to Dr. Whitman, or to Roy, excuse me.
Hey, everybody, welcome. Thank you so much for joining the call. Just as a brief introduction, I've been at RxSight for about 8 years, and I would say that in marketing, we spend most of our resources on patient education. I mean, obviously, the light adjustable lens is different. It has its nuances, but patients really need to understand what the lens is between the lead and conversion time. And so we found that we put a lot of efforts there. And over the years, I've been just watching Clarity from the sidelines and really seen them grow. There's probably been about 10 companies that are similar that have kind of come and gone, and from my perspective, but they're sticking around, and I think that they've had some great success. And so we said, yeah, it's time for us to join with them, and I think it's a very cost-effective approach to increase that information during that time. So we're really excited. We just started and created these videos, which you'll see today, and I'm happy to answer any questions as we go along. But with that, I'll just pass it on to Dr. Whitman.
All right. So, and welcome everybody that's here today. Like many of you, I had a long all-day surgery day today, and about 20 to 25% of our the 40 lenses I did today were LAL, and so it's an important part of the practice, both LAL and LAL plus. And what we like about it, it's the most advanced cataract technology available today. But getting that point across to the patient and without spending all day having to talk to them about it or having your staff spend a great deal of time has become for really all premium lenses, a difficult problem. We have a lens now that we can adjust the vision after surgery. That's the major differentiator in the market. We need to let the patients know about that. We're able to customize their vision with the patient having the say-so about what the outcome is, which, by the way, makes it great for engineers, type A personality people, where you can tell them, you make the final decision. We don't make the final decision. What are the sweet spots in my practice? Well, certainly post-hyperopic and post-myopic LASIK. I find post-hyperopic is I just stay away from multifocals in those patients because it's rare that the post-hyperopic topography shows you that it's centered, and you want to have the center multifocal-wise over the center of your hyperopic ablation. That's very difficult. So that's why sometimes you get weird vision afterwards. I think it's a chance not worth taking. Post-myopic, particularly if they're moderate to higher amounts of nearsightedness, flatter Ks, any of them are just a sweet spot for whether it's post-hyperopic or any post-myopic are great for this. To me, not great for my multifocals, and I like multifocals, just not for not in the post-refractive surgery side. Post-RK, we did over 20,000 RK in our practice, and so a lot of people will say it's the gift that keeps on giving. But it does allow you to capitalize on these patients that wanted premium vision to begin with, were willing to pay more to begin with, and now you can give them light adjustable lens and give them that kind of seamless distance intermediate close up, because RK already has a multifocal cornea to some extent, and LAL just builds on this, and they are some of our happiest patients. And hitting that target endpoint for them can be difficult. One of my partners says, well, who cares? I just want to get close with LAL, and I can make them 20 happy. mild to moderate keratoconus. There have been a number of articles out on this lately. Bill Trattler's done some really fine articles on this. And, and of course, our sweet spot are normal eyes for patients that want the most advanced technology. That hits some buzzwords in a patient and they want the latest thing. And when you tell them that you can do their surgery, wait a couple of weeks for things to stabilize, and then treat them with a UV light, not a laser, to fine tune their vision and give them more a depth of field of vision, they just think this sounds like space age. And even when I say it still, it seems kind of space agey to me. Here, you're able to give them something extra. And of course, patients love flexibility and personalization. They want it to be their own. So we want to deliver on that promise, give them that flexibility. And again, we use both LAL and LAL plus. And again, they allow for titration of the visual endpoints to optimize near to fore clarity, provides flexibility for both post-refractive, non-refractive eyes, and the clinical results consistently show success when endpoints are managed properly. What do I mean by that? My particular preference is I use LAL in all post-refractive patients. Because of that different center in the LAL plus, again, that matchup I think can be a little different in some post-refractive surgery patients. You just don't know which they are. And I don't have to worry about that with the LAL. Whereas I tend to use the LAL plus in almost all my non-refractive surgery patients because two things. It automatically gives them an increased depth of field to begin with that's fairly wide. And it allows me to do less treatments. And I'm actually giving a paper on this at ASCRS, so if you're going to be there, please come see with some of the paper presentations. And the reason is that with this LAL plus, I can go for my specific distance target in their dominant eye, and I can go for, well, let's say, minus 75 in their non-dominant eye. And unless they have a lot of astigmatism, I might hit them bang on and be able to go to lock-in. Again, less chair time, less time having to, refract, put numbers in. You can get a 20 happy patient quicker with it. And it gives that nice increased depth of field. And even going to minus 75 in this lens, which often will give me J2 or J1, they usually see 20/30 or better, often 20/25 in their distance. So they're 20 happy, which is our goal. So, it's just a lens platform that gives us high patient satisfaction and really stronger visual outcomes without getting halo, glare, contrast sensitivity issues. It's easier to hit your sweet spot because you can titrate to that sweet spot using the light delivery device. I mean, it's a better mousetrap, but we do need to educate our patients. So setting expectations. We actually, and we learned from our crystal lens experience many years ago, that we developed a patient information sheet, and through Roy, we can get that sheet to you if you want to use one similar to mine or modify it to see what works for you. But it gives a surgery timeline. When are we going to do the surgery? When are we going to see him post-op? And talking about refractive stability before we start to do their LDD treatments. Because we just weren't telling them that specifically, and we'd get question, we'd get calls, we'd get unhappy patients because they didn't know what the timeline is and when are we going to do the next thing. We do tell them that there may be a number of visits for their LDD treatments, but when? That's what they're thinking about. So we let them know that. We let them know about how much time they'll be in between treatments. We usually try to do both eyes together, save them time, save us chair time as well. And we let them know there's a possibility we'll do YAG before their lock-in, so we don't get any micro changes that we may regret locking them in.
Sorry about that, Dr. Whitman.
No, not a problem.
Hmm.
So an informed patient feels involved and confident. You don't want a patient coming in when they paid a premium price, and this is our highest price point for any of our premium lenses, because we have to do more measurements, we spend more time with the patients, we do the LDD treatments, that we want to deliver on that, but we don't want to have the patient think that we're not communicating with them. They don't know what's going on in the process. And once we started doing the explanation sheet, we almost get no questions about that anymore. They just want to know, they're looking forward to the next treatment or their first LDD treatment. So, want to prevent confusion, increase patient satisfaction, because I think when patients understand the why and the when, the experience almost always improves.
All right. So the common challenges. When we think about the dynamics that exist in the practice environment and the challenges, as touched on by Dr. Whitman, we understand that we have limited staffing and resources, patients' lack of understanding relative to the options available to them, inconsistent information, and missed opportunities. All of these dovetail into this moment, what we call is the height of interest, the time of need that our patients experience when they're confronted with the eye condition that necessitates, a cataract surgery or an LAL operation. And now we're in this moment where they are hungry for information. They want to understand what the possibilities are, and the possibilities are a range and they're nuanced. And there's all kinds of interesting information that we want and do need to provide to them. But our challenge as a whole are these items here, that we're limited with what we can do. We're limited in terms of the time that we have. And so what we have found within what we do as an organization is that we have the opportunity to target pre-consultation education at our patients that can do a number of things as they navigate through this delicate moment. So the first one is that it can improve patient understanding of the surgery itself and the various options that are available to them. Additionally, it can help decrease pre-op anxiety about surgery, so they're coming into the moment in a more relaxed and calm state. That improves not only their interaction with the provider, the conversations that flow out of consultation and pre-surgery, but also just their experience with the surgical procedure. Additionally, the reduction in chair time and the increases in practice efficiency. We have patients coming in an informed state, so now they're asking more relevant questions. They're moving from trying to make a decision state to where they're ready to make a decision and want to understand the derivatives of that decision. And further, that it increases the practice efficiency, so less time communicating with patients up front, as well as less time answering questions after consultations and after the procedure. And so, and the last opportunity that this presents to us is that we can educate patients so that they ask for the LAL, that this allows them to come to the experience ready to understand the nuances and the benefits of this exciting technology. As Dr. Whitman said, and I think this is just such a key point for patients when it comes to LAL, is the ability to dial in the experience after the surgery. It's available in no other modality for the patients, and this is just such a significant differentiator from the patient experience, and that's a real key differentiator that we want to hit on in that patient education experience. So we have this unique window, this tiny window that we want to pierce the veil and make sure that we're educating those patients properly.
And Brad,
Yes, sir.
Being a practice where we've used Clarity for a number of years, and for lenses that have gone before this, we use it primarily as an education platform. So I want everybody that's listening to know this wasn't developed for a specific lens. It was first developed to educate patients about cataract surgery, so there were less questions when they came in, and there was more understanding, more education before they came in. But to me, the best thing that can happen is when a patient sits down in the chair and they tell the tech already, I heard, I got the information on my phone about the light adjustable lens. Talk to me about that. 90% of our battle is won there. Now we can go down one direction. I mean, it just makes life simpler. And they already have the basics about cataract surgery. It's just a wonderful platform.
Absolutely. And I really appreciate Dr. Whitman, you honing in on that point, because the key point when it comes to patient education is awareness. We want to drive home awareness of the available options, and allow them to come to that moment where they're prepared to ask intelligent questions, make effective decisions, and move the process forward in a way that benefits them the most. So definitely spot on in terms of our purpose and what we seek to do when it comes to patient education. Now, we've done a number of different studies in the organization over the course of time, and what we've been able to see is that with effective patient education, 45 patients are willing to trade up to an ATIOL and willing to pay more, versus an industry standard of around 15%. What this tells us is that the efficacy of patient education, when delivered at the right time in the right way from the right source, really empowers more effective and more productive decisions for the patient, the provider, and the practice. Marcus, anything to add to that?
Yeah, I mean, the timing is the key here, right? And so one of the things, Dr. Whitman, you mentioned is the sheet that you have, right, in order to prepare people. And that's been a great way. But often we know that patients, even if they get written material or even if they get sent email or other forms of communication, sometimes those get lost in the trash, or they may be overlooked. And so while they are certainly effective, if patients pay attention to it, what we found is that engaging them with video content via mobile, which we're going to talk about more specifically, it becomes a really effective communication tool. It does a couple of things. Video first really drives home the emotional impact. That also gives them a reference point to be able to go back to. They can watch videos anytime. They can share it with their friends or their family or their loved ones who are helping them possibly make those decisions. And because we're addressing the expectations ahead of the cataract evaluation, we're getting at things like to what Dr. Whitman mentioned, just being educated on cataract surgery, just that in and of itself, there's a lot of fear around that. Years ago, we went on Nextdoor and, we saw, just local people talking about, are they cutting into my eye? Are they, there's just a lot of sort of misinformation or maybe just incorrect expectations. And so by having this come from your practice directly to your patients ahead, you really get a lot of those fears and those questions addressed before you even get to see them in your office. And so that's a huge benefit, and that's a big part of why we see patients elect to upgrade to a premium option, is because they already come in having worked through that decision or worked through those considerations.
Absolutely.
I would just add to that, Marcus, that, from our perspective, we did a survey of a couple hundred patients trying to tell the story of the light adjustable lens. And the conclusion we came to, as you guys would know better than us probably, but that when you tell this, you have to tell it in the context of what is cataract surgery. And I think that that's what's been so great about this video, is because then they sleep on it, they get it the night before, they understand cataract surgery. And it does take time. Like when we did our focus group, it was like, we're like, oh, it's a customizable lens, you should all want it. But they really need a lot of information to get there. And I think these videos do a great job of that. And they did in our testing. So we're excited about that part.
Yeah, and not just cataract surgery, astigmatism, presbyopia,
exactly.
other things that can be corrected through the technology that's available. So yeah, it does give them time to digest and really think through that.
And so, speaking of the technology, that's a nice transition to where we're at in the webinar, which is to tell you a little bit more about the Clarity Practice Performance System. And really, in our minds, this is patient education in the palm of their hand. We recognize that we live in a mobile world, and so we've developed a suite of technology solutions within our platform that enable and empower practices to convey personalized patient education messages, and we'll talk a little bit more about those messages in a moment, directly to the mobile phone, so the patients have convenient on-demand access. These patient education journeys is the term that we use, are expertly curated videos to help answer common patient questions. And a journey is for us is a series of episodes. Each of the episodes that we create, and as example for the LAL journey, that's 3 episodes, runs around 90 seconds to 2 minutes. The point is that these are targeted single topic episodes that are readily consumable by all patients at all ages. And that we know that when we combine this mobile first mentality with expert created content, we have a very high patient satisfaction, leading to improved outcomes and recovery and increased adherence. Marcus, anything to add to that?
Yeah, I would mention, a really key part of our technology is that the patient isn't required, the access to this is extremely simple. And so the patient isn't required to, download an app. They're not required to create an account with a password. They're not, trying to get an email or text message with a 6-digit code to try to authenticate. It's coming directly from the practice, either, through one of our sending methods. Our most popular is integrating directly with a practice management system, and the patient, it looks like it's coming directly from the doctor, and it's one click. They just click the link that comes to their mobile phone, and they're right into the video experience. And I believe we're going to we'll show that off here in a minute.
Absolutely.
And by the way, I'm just saying it works. So from the 25-year-old patient to the 87-year-old patient, they all find it easy. The younger patient thinks you should have it. The older patient is kind of wondering, well, what I do, is this going to be hard? And they just hit the button. And if you want to do add-ons later on that aren't just cataract related, but you want to be able to say, hey, happy birthday to your patients, or call them the night before surgery. There are add-ons that I've added onto this, that personalize it. I can't tell you, I'm patients laying down having surgery done, and they thank me for making that special call the day before. You can make your practice stand out, and also have you or your staff spend less time on the phone. Clarity's got this figured out very nicely.
Thanks, Dr. Whitman. As we move into a little bit more detail about the combination of the technology and the content coming together to develop that patient experience, what we're showcasing here, and I'm going to tell you a little bit about the technology and then turn it over to Marcus to have him tell you a little bit more about the content itself and the curation of this story. But as you can see on your screen right now, we've shown the 3 episodes that constitute the RxSight journey. But what I want to call attention to is some of the graphics that surround the video. So we've got the RxSight logo at the top and their color scheme. And then you can see at the footer, we've got some footer information. All of this is personalized to the practice. We're showcasing RxSight here tonight, so we personalize these to RxSight. However, when our technology is used by a specific practice, it is the practice logo that's here at the top. It is the practice that decides the color scheme that is packaged around the journey that is sent to the patient. And it is the practice that defines the footer information. So, specific practice contact information, email addresses, directions to the practice, and so on. And so this is effectively personalized to RxSight. But one of the things, as we touched on earlier, is that it's important that the information lands from a trusted source. And so as we deliver our journeys through our platform, we do brand them at the practice level, so the patient has a uniform experience across the entirety of their journey, including and especially the moment when we're seeking to educate them through our technology. Marcus, do you want to jump into the content itself?
Yep. So we partnered obviously with Roy and his team, and clinical team as well. And we also have a medical advisory board, of which Dr. Whitman is a part of, with other other key opinion leaders and experts in the industry, to really go through and vet this. And so really what we wanted to do is keep it as short as we can, keep it as simple as we can, and really highlight the main points that set the correct expectations for patients ahead of their cataract evaluation. And so, as we mentioned before, the first episode just talks about cataract surgery, right? So, hey, we assume that they're brand new. We assume that they got a lot of questions about cataract surgery and what that process looks like, and its safety and its efficacy. We mentioned things like it's the #1 surgery in the United States with over 4 million a year. Like we use data to support exactly what the message that we're saying. Second episode really covers the light adjustable lens and the technology itself. It doesn't get so nitty gritty that you have to be a scientist to understand it. It's really just so the patient can understand really what the benefits are of the light adjustable lens, how it's different from other options that may be out there. And we set expectations that this is an out-of-pocket of expense, most likely. And we do that because we want to address those things ahead of time. So if somebody has, concerns about maybe, this is just something that I can finance, is this something that, I can afford? Then again, kind of to your point earlier, Roy, right? They have time to really kind of consider that and think about that ahead of their appointment. And so they come in far more ready to discuss those options than rather than waiting to, a couple hours to speak with a surgical counselor who's now going to hand a laminated sheet, right? That says, hey, here are all the packages and different things that you can go, and they're tired. So, and then the third one really is about the LDD process. And so what we found is that, setting that expectation about post-surgical, that cadence of adjustments, and not just, okay, how many times am I going to have to come in, or what is that process like, but really giving the patient the tools to be able to think about what kind of vision they really are looking for, right? And everybody's going to have a different preference. Some people really want to be able to, they want to see far, right? They want to be able to, maybe they're super active and they're outdoorsy, or, and some patients really, reading is incredibly important to them. And setting that expectation is that you're not going to get perfect vision all the way across all distances, but we're going to find one that's going to dial it in for your needs, your preferences, your lifestyle, and what that process actually looks like for those following weeks. So we do have a fourth episode that we also created that is available, where that patient can share the same information with a loved one, as I'm sure you've all experienced, right? I need to go think about this, or I need to go talk to my family or my significant other before, I consult with making a decision, and a number of those things. And so that's a fourth one that we do have available that we can implement into the program should you choose to sign up.
Cody, I noticed we've had some questions rolling in. Just wanted to pause for a second. Were there any relevant questions we needed to address, or are we good to kick on?
I'll jump in and just shout it out since we're on that topic. Somebody had asked, what is the time frame for pre-consultation education in relation to ASCAN or ASCAN? Who does this?
First of all, and I'm sure you don't mean ASCAN anymore, but you mean, Iowa Master, Argos, whatever. But so we do our marketing, et cetera. Patient calls in, may be interested in a lens or a premium lens or any lens, and just realize they want to get a cataract evaluation. It could be any of those things. We have them in, they get a basic exam. They get refraction, topos, glare testing if needed. So we can look and see what they're a candidate for and what they're not a candidate for. And then we tell them what lens we think they're best for. And we may give them two other choices, but we always number them 1, 2, 3. So there's always a number one. Patient comes to the doctor for an opinion, and it's best that you give them one. That's why they came. Don't feel like you're selling something. Feel like you are giving them your best opinion. Once that's done, we usually will reappoint them to both see the counselor and get their scans done all at the same time. And we'll also do a little pre-op exam that same visit. You can't bill for that pre-op exam unless it's done on a different day, by the way, and can't be done on the day of surgery. It can be, but you can't charge for it if you're interested in, if you do physicals, and if you're interested in charging for it. But in any case, they'll get their counseling. They'll go over any video, their informed consents, and they will get their, we do Argos and Hogstrite measurements. And if they see something that they're concerned about, the counselors are pretty bright now. Most of the ones we use, we have 13 offices. We have a lot of docs, a lot of counselors, but we've tried to keep the approach pretty unified. But if they see something that doesn't make sense to them, they'll bring it to the doctor right away, if possible, to say, hey, are they still a candidate? Because what you hate to do is, have somebody that has a 32 millimeter eye and there really isn't a premium lens truly available for that eye, and you want to let them know right away, or you're going to do some kind of piggyback experience to get them in that range. But again, we separate those visits. So the main measurement visits are done at the same time as the counseling exam. The counselor in their hand and the patient will have that list, 1, 2, 3, of the lenses we thought were best for the patient.
If I could add to that as well, for the video education in particular, we most often send this upon a referral. And so a lot of times referrals are coming in optometrists. And so that's kind of our first opportunity, is to send it, 2-3 weeks ahead of that initial consultation. But the content, like the video content, it's all available in office as well. So if they don't get it ahead of time, the opportunity is we're going to talk about these different methods that it can be leveraged, that could be within the office, on a QR code, in material. There's a number of different ways along that patient journey. So it's not exclusively just to one point or the other. And so what a lot of times we'll do is we'll work with the individual practice to see which is best for you, right? What's going to work with your workflow? Where do you see the greatest opportunity to set those expectations correctly? And so, Brad, you're probably going to get into the different send methods here, and I might bring a little more color to that.
Yeah, absolutely, Marcus. It's a great transition. So we recognize through the growth and development of our technology over time, and we've had the great good fortune to work with hundreds of practices across the country. And what we found is different practices do different things. They have different workflows, different tools, different mechanisms that they want to leverage in their technology stack and their procedural stack. And so as our technology has matured, we've created multiple different start methods. Now, for us, the term start method means a way that a journey can be initiated to a patient. And so we have multiple different start methods that I'm going to speak about here. We, as a systems provider, are not prescriptive. Right? What we seek to do is to provide a suite of options that then the practice can leverage as they see fit. Looking at these various start methods and the tools that are available to them, we can certainly offer up, and often do offer up, recommendations based upon their workflows and our past experience with practices. But again, these are meant to be use as you see fit modalities, and are available. All of them are available with any subscription to our platform. So the first one that I'm going to talk about is actually the most recent feature that we've released. Is called the Watch Link. And so what the Watch Link is and I'm going to talk about some of our other start methods in a moment, but we as a technology provider, being a mobile first company, grew up with SMS, and that was sort of the heart and soul of what we centered our patient education efforts around. And so it was really the delivery of these patient education journeys through SMS. And although that proved to be very successful, and we continued to evolve the technology that supports that, we did continue to get feedback from our practices that we love the SMS delivery mechanism. We love the journey content, but we have other ways that we want to deliver the content. We want to deliver it in office technology, in an iPad or on a smart TV. We want to put it on a website or a social media post. Is there a way that we can quickly integrate this into an appointment reminder system? So we aggregated all of these needs across these hundreds of practices and hundreds of inputs that we got, and developed a feature called the Watch Link that allows the practice, each individual practice can define a custom link and QR code for any and all journeys that are associated with their subscription. So as an example, a practice has the LAL journey associated with their account. They can create a watch link that they could put on their website. They can create a separate watch link that they could put in their appointment reminder system. They could create a third watch link that they want to link on an in-office iPad. And all of those, as soon as the QR code is scanned or the link is hit, will go directly to the video content. There's no SMS message that's sent. So it's a really powerful way to send out the journey, and is really flexible across a number of different modalities. And we've seen, we released this feature about 3 months ago. We've seen practices using it in a host of different ways, and it's really exciting to us to see how it's being leveraged. But again, not intended to be just prescriptive to practices, but rather a mechanism that a practice can leverage as they see fit. The next start method that I want to talk about, and this is where we kind of pivot into SMS-based journey sends, is something that was touched on earlier, which is the EMR PMS data integration. So this is where we get our technology system to talk to your technology system, and we make sure that the correct, through that integration, the patient information in terms of their name, their mobile number, their procedure type and code, the provider ID, and some other relevant metadata is mapped back to our system. And so when that appointment is scheduled, that will trigger our system to send a specific journey based upon those mapping characteristics. So a particular procedure code will often define the specific journey that's getting sent out. And through integration, we're able to do that. Integration, in a nutshell, is a set it and forget it modality. You set it up and it fires. And we have a number of native integrations with Nextex and ModMed, a few other EHRs. as well as a bridge partner in Promptly that allows us to integrate with 20 or 30 additional EHRs. We'll show you a graphic here in a moment that details them, but it's a very powerful way that we've worked with roughly half of our practices. So about 50% of our install base is currently integrated. And it's a hands-free automated patient education. The next start method that we have available is called the patient portal. This is a mechanism where users at a practice can log into our tool. Not only can they access reports that give them insights into how the journeys are performing, but they can also direct send a journey to a patient right then and there. So it's an on-demand tool that allows the practice themselves to send a singular patient journey to, excuse me, I dropped my mic there, that allows a practice to send a specific journey to a specific patient. The last start method is called the web form, and in many ways it's similar to the practice portal, but what we do is we create a link and a QR code for any journey that's associated with the practice subscription that's available for the practice to then post and leverage in any medium that they want: email, appointment reminders, similar to the watch link. It can be used on an in-office iPad, it can be used on a website, but the key difference here is that what the web form allows is for the patient to self-subscribe to the journey. So in this moment, the patient would see technology that's very similar to the practice portal, where they would put in their name, their patient number, their mobile number, and send the journey to themselves. What's important to note about these start methods is that they all offer reporting and provide you insights in terms of journey performance. However, with integration, the practice portal, in the web form, because these are SMS-based or text-based modalities, we know, our system knows who specifically the journey was sent to and what that patient's phone number is. So then we can provide more granular reporting and give specific details on what that particular patient did relative to the journey that was sent to them. With the watch link, because the patient is just hitting a URL and there's no SMS message, we do offer reporting. It is individual in that we can see that the separate individuals hit a given watch link, but it's de-identified. We don't know which user has sent it. So there's just a bit more level of granularity in the reporting when we're talking about SMS. But these are the mechanisms that we provide to practices that allow them to send out the patient journeys. Marcus, anything to add to that?
Yeah, and so if you're thinking about what's best for me, I could, the watch link's really great for appointment reminders, for really kind of that broad broadcast. That's really, if you want to get it everywhere, that's the best method. If you're trying to capture cell phone numbers, the web form is a fantastic method to be able to get names and phone numbers. And I think we briefly touch on it later, but there's a report in there where you could see the name, the phone number, the journey activity, all the way down to be able to follow up with people. So once that comes in, you can see their identified data. Obviously, set it and forget it. That's our most popular. It is the best without human involvement for operational efficiency. But if you are a practice that has more of a desire for a personal touch, or maybe you have a call center, maybe you're a larger office and you have people that are calling and scheduling, the practice portal is still a very powerful method, because it's that personal touch of, hey, I'm going to send you some information, I'd like you to watch it. And by all those start methods, yes, it is manual, but it's pretty easy to incorporate into a scheduling workflow. That definitely has much higher engagement because there's a human interaction to it. So it really depends upon your operational workflow. And I should mention with this, we have a CX team that works individually with practices to optimize that. So it's not something that, hey, I got to kind of figure this out. It's like, no, we have best practices here. Let's figure out kind of what works for you the best. And then our team just takes that on and sets that up according to those requirements.
And I think it's important to note on that, Marcus, as well, that as you log into the system, when you have an account, you have immediate access to support. In the lower right-hand corner, there's a little message icon, and you can immediately contact our support team and address any questions, concerns, so on and so forth. So yeah, great points. So as I mentioned earlier, we offer integrations with a number of different partners. We've featured the bigger ones here that we've integrated with. So I'm just going to kind of pause here and give it a look. Cody, I didn't know if any additional questions had come up that we wanted to address.
No, I think we're good for right now.
All right, cool. All right. So we touched on this a little bit earlier when we showcased the journey itself with the RX site branding or personalization applied. But we have some other options that are available that we want to make you aware of. So we do have the opportunity for practices to do a personalized intro. And so this is where, we partner with the practice and our production team works directly with them to record the video. That video is provided back to us. We do some post-production work and refine that video a little bit, and then we can associate it with the journeys that are sent by that specific practice from that specific provider. Marcus, I know you and your team, he's running the
Yep.
production house. You probably got a lot more to say about that than I do. So
Yeah,
I'll hand that over to
yeah,
you.
sure. I can kind of run through these real quick. This is really great if you have, if you really want that personal touch, if you want the first face that the patient sees to be the provider's face, right? Or maybe it's your staff. And we have a lot of practices that choose to do a number of different things. Some of them like to show their, the office, so they like to show the front staff, or there's a number of different options there, but it's really the first thing the patient sees before they get into the content that we want them to watch. And we made it really cost effective as well. So we have an entire uh, process by which we go through to help practices be able to film this themselves, and then we just take it from there and incorporate it into the journey. Some doctors, they want to be the doctors that are featured in the videos, so they look at the videos and they say, hey, I'd like these to be modified a little bit or changed a little bit. And so we work with those on a case-by-case basis for people who want to bring an additional level of customization. As mentioned before, everything's white labeled, so we know that it's coming from you. It's your logo, it's your colors. Then there are other providers that have, maybe they are a dynamite YouTube star already, and they already have video content, or maybe they have a bunch of videos that they develop on their website, and they just want to get those videos into a journey format to be able to send to patients. It's another way that we can customize that experience for your patients. And then personalization, obviously we all know this, it builds trust. And so it gives you an opportunity to represent your practice and your brand and your messaging directly to your patients as a first impression, which goes a long way.
Absolutely. So I want to talk to you a little bit about a recent cataract patient survey that we executed in October of 2024. We sent this out, Marcus, correct me if I'm wrong, it was to around 80,000 cataract patients across the country. And we had a little over 21,000 respond back and respond to the survey. I have that correct, right?
Yeah, so it was 84,000 is actually
Okay.
a little north of that. And then we had about 25% interact in some sort of way, and then nearly 12,000 actually completed the survey, which, Brad, I think you have the questions up here that we
Yep.
asked, and we wanted to just keep it really simple.
Yeah, so these are the three questions that we asked in the survey. Did you find the patient education series helpful? Did you, in fact, move forward with your cataract surgery? And then did you choose an advanced technology lens? So of those 12,000 survey respondents that completed the survey, this is the results that we found. 25% of the 80,000 engaged with their journey. Of them who completed the survey, a little over 90% found the video series helpful. Nearly 90%, just south of that, had or were scheduled for cataract surgery. And then just over 42% chose an advanced technology lens. Now, we know that there are a number of factors that go into this decision-making process, but we also know that the industry norm for choosing an advanced technology ranges somewhere around 15 to 20%. So this gives us great confidence that this is gas on the fire, that what we do in the world of patient education, that when we deliver the right information at the right time and in the right way, has a profound effect on the decision-making process. Marcus, anything to add to that?
I mean, just slightly, we did a survey with our practices as well the year before that. We showed similar results where the practices reported from their own conversion rate numbers a similar increase. And so we had practices that were at 15%, 16% that went up to 35, 40%. For the same surgery volume, that's a direct impact to revenue, right? And so that's a huge advantage for the practice to be able to not really have an additional huge workload, but really with the patient being educated, they're coming in already asking. So the likelihood of their upgrade is much higher.
And to touch on something that Dr. Whitman spoke to earlier in terms of, the purpose behind what we do in patient education is not only does it have an impact on the practice, but this also has a profound impact on patient outcomes. So an informed patient, generally speaking, makes a better decision, makes a decision that they are going to be more excited about, have a more profound experience with over the course of time, because they were able to move through that decision-making process in an informed way and land on a decision that works best for them, rather than making a decision with partial information, or in some cases incorrect information, and then landing on an outcome that isn't ideal because they weren't properly informed to the options that were made available to them. And I know that's the goal for all of us that are in this space, is to make our patients as informed as we can so that they can have, aware of the suite of options that are available to them, and they can make the best decision that they're capable of making, and we can move forward. So yeah, really excited about what those results showed. And what we feel the impact that our education has. So Marcus touched on this a little bit earlier when we talk about analytics and insights. So what is it? How do we prove our value? How can a practice know that these journeys are having an effect? And we do that through two different ways, two different reports, although we've got 3 bullet points here. The first two, the journey activity report, the 12-week trend report, technically on the same reporting feature in the platform called journey activity reports. And so the first is a snapshot of your monthly activity that tells you how many journeys were sent by journey type. How many of those journeys did a patient interact with at some level, which is to say started the journey, and then what was the watch rate percentage? So on average, how much of the video content was watched by the recipients or the recipient patients? We do these month snapshots, and the practice can showcase or track 2 different journeys in their subscription, as well as scroll through different months to get different views. But we also provide a 12-week look back. So it's just a quick snapshot of how the journeys have performed in the last quarter by start method. And then in addition to that, for those journeys that were sent out by SMS, we have the recipient report. This is where we get to that additional level of detail, and you can see which specific patient was sent which journey on which date, and how that patient interacted with the journey. More specifically, how much of the content did they watch? Anything to add to that, Marcus?
The only thing with that recipient report, it's really powerful with follow-up. So if you know that somebody's engaged with, they have a high level of engagement, your likelihood of having a better patient experience with them is much greater. And we have sorting features, so you can sort all those to the top to see who's the most engaged and who's least engaged that you might want to attempt to reach out to again. So it adds that level of personalization, that customer service that's really effective.
Absolutely. I'm going to keep this one up on the screen for a moment for any of you who are interested in checking out the journey. You can leverage this QR code. This is directly from our platform. So feel free to take a grab of that and check it out. In the follow-up and communications we'll be sending out, we'll also be providing access to the journey, so you can see that through that mechanism as well. Cody, anything to add to that?
No, I just dropped the the watch link, the watch link in the chat as well.
Okay, I just tried it and it errored. I can provide an alternative link if we need to.
Yeah, must have grabbed the wrong one. Sorry, guys. We'll definitely follow up with the correct.
I'll provide an alternative. This one goes to our website that has all the videos that you can preview. You can watch them in full. They're just watermarked, so but yeah, you can watch them, or scan the QR code and you get them. You'll get the experience on the phone if you scan the QR code exactly as the patient would get it.
I see there was a request. Can someone share the patient information from Dr. Whitman? I'm assuming, Cody, that's something we can address in that sort of follow-up communications.
That was the one sheet that Dr. Whitman referred to earlier.
Yep.
Yeah, and I said, hey, the Roy's people or somebody can contact me, and I'm happy to get it to anybody that wants it.
Got it.
Cool. Yeah, we'll definitely include that in the.
Got it. Okay, cool. Yep, I was just scrolling through the questions, see if there are any additional ones. I didn't see any. So excellent. And so just going to open it up for questions and see if there's any additional information that we can provide. Certainly appreciate everybody's patience and due diligence and working through the webinar with us. But yeah, Cody, I guess if you want to open up the audio and see what questions we have, that'd be great.
Yeah, let me just allow everybody to talk. If you guys want to chime in, if you want to drop some questions.